Do you have mental health issues or know somebody who does? Are you happy there's a place where we put the craziest of crazy? Do you like hard liquor? Well, then let me introduce you to Muhammad ibn Zakariya al Razi. He was an alchemist, an author, a physician. He's considered to be the father of psychology and psychotherapy. He's the creator of the first psychiatric hospital. He's commonly known as Razis out here in the Western world. Born around 865 in Al Ray, a city near present-day Tehran in Iran, started off being really into music, like we all are. But as he grew up, he would go on to study alchemy, philosophy, and eventually medicine, which became his primary focus. He moved to Baghdad for medical school. Now, in Baghdad, his teacher slash mentor was Ali ibn Sal Rabban al-Tabari. Now, not only did al-Tabari teach Razi's alchemy and medicine, but he's also believed to have helped cultivate the philosophies in Razi's, which would later go on to shape his views on how medicines and treatment should be administered. Through his alchemical practices, he's been credited with the discovery of sulfuric acid and is also credited with being the first to distill ethanol, providing the ability to make stronger spirits. My old friend was whiskey, and we can thank him for that. So it seems like not only is right now, it seems like he's creating a problem to come down the line. But I guess you could say that his actions have led to the creation of, I guess you could say his actions have led to the creation of, nope. I guess you could say his actions have led to the creation of and solution to all of life's problems. Now, although he was seemingly very proficient in the ways of alchemy, he had to stop around the age of 30. Unfortunately, the years of meddling around with various unknown chemical compounds began to cause just constant irritation. And I personally hate nothing more than getting something in my eyes, so I totally get it. And this gentleman here is messing around with all sorts of various chemicals back in the, early around year 1000, because he was born in 965. So yeah, a little over, year 1000. Just we have no idea. He would later in life he would go blind, and it is believed to be a direct result of the time practicing alchemy. Now, the tutelage provided to Razis by Rabban al-Tabari was so good that the student eventually surpassed the teacher in proficiency, and he went on to make a real name for himself as an extremely good physician. He did so well that he was able to use his growing social power to also become he did so well that he was able to use his growing social power to also become a popular author. He would go on to author between 224 and 237 books, depending on the source, including medical encyclopedias, which became popular learning texts in the region. His ever-growing social footprint wound up catching the attention of the local caliph, sort of like the local governor, and that gentleman's name was al-Muqtafi. Through his discussions with Razi's, al-Muqtafi was so impressed that he wound up making him the chief director of the soon-to-be-built Al-Mu'tadid Hospital in Baghdad. Now, as chief director of the hospital, named after al-Muqtafi's father, he was tasked with selecting the location for the new hospital, which would be the largest hospital in the Abbasid Caliphate. He had a very interesting way of determining where exactly this new hospital would be built. What he wound up doing was he would he would go around and laying pieces of meat in various places throughout the city, kind of like a person who maybe needs some psychiatric care. But he let a couple of days pass before he went back and check on them. Basically, he let them sit in the sun, and he then went and saw which piece of meat rotted the quickest, going on to choose the final location based on the fact, or at least a belief, that the air was cleaner and therefore healthier where that piece of meat was found. It was basically a really early form of germ theory. The location that the meat rotted the least is where the hospital would be built. It truly is amazing for a physician at that time to have a working understanding of germ theory, as it would much later, become known as. But just the awareness, people often think that folks that lived that long ago were like simple folks or whatever. And it's like, no, just as we are, we're all doing the best we can with what we've got. So going back to the story here, the prevailing theory of medicine at the time was that the mind and the body were two different things. The thought was that the mind was, quote, not subject to mechanical laws, meaning that there was no physical treatment available for mental issues. Health issues were sort of thought to be the responsibility of ghosts or demons or moral failings, you know. But Dr. Al Razi truly did not agree with the mind-body dichotomy, instead believing that mental illness was absolutely a medical issue, what we know now. And he believed in what he called a sound mind and a sound body. Basically, he felt that if you treat the mind as a physical problem, or treating mental wounds in the same way you would treat physical ones, then the outcomes of these people would be much better. It's amazing how long ago, you know what I mean, that this idea was in the medical community, and it's just sad how long it's just sad. It's just Razi firmly believed in mental illness as a medical illness. He pushed the view that hope should be a mainstay in treatment, giving the patient the hope that the treatment that they were about to be going through, that they would be able to be remedied, or at least they would be able to get well enough to go back out into society. He had more holistic views on things. He felt that mental illness was best treated through proper diet, the medications available at that time, which mainly like herbal sort of treatments there. He also believed in occupational therapy, aromatherapy, therapeutic baths. And as a music lover himself, he also pushed for there to be music therapy. Now, what we know these things to be today is not exactly how it would manifest then, but the concepts are the same. So he is also credited with being the first physician to suggest that specific hospitals or wards be created in which the mentally ill would have access to the appropriate care that they desperately needed while maintaining safety for all. He was a huge proponent of and advocate for doctors having a well-tuned bedside manner. Now, I personally dealt with some really, really bad doctors. There was one doctor this one time who told me that he was only able to see me because he had worked all weekend, and I'm like, well, what the hell am I supposed to do with that, sir? I mean, you're a psychiatrist, and I'm here to see you. You took this appointment. Anyway, I digress. Um, but with that bedside manner, he wanted them to have the ability to make the patient feel seen, heard, you know, understood, and feel like they were being treated by people who truly care for them and their well-being. He also practiced an early form of what we now know as CBT, or cognitive behavioral therapy, and is the first known doctor to describe the idea of psychotherapy. Psychotherapy is, you know, basically talking to your therapist, you know, talk therapy is, as most people may know if you're not familiar with that term, but one of his core beliefs was the possibility of rehabilitation. He is believed to have been the first physician to not only recommend all these, you know, treatments that we've already discussed, but the psychiatric aftercare component. You know, a lot of times when somebody's been hospitalized, you know, there's what do they do afterwards? You know, once you get them, these are mostly like what we have now specifically. They're mostly acute units where they try to hold you until like the major problem that brought you to the hospital in the first place, like that is addressed. But then there usually is supposed to be some sort of aftercare plan, and we can thank Al Razi's back in the day with all the craziness that we're getting out of Iran. It's nice to see that's some positive news here, you know? Uh, some crazy Iran news, but not the kind we're used to getting here. Anywho, at his hospital, patients were set up for success as best as possible. Part of the discharge process back then was making sure that the patient was being released to the best possible situation, made sure that they had a little bit of money, because he truly believed that people being treated for mental illness absolutely could smoothly transition back into society, as a healthy, productive member of that society. In 907, when the chief minister of Al Muktafi named Adhud al Dahula, the leader who appointed Razis to his position as the medical director, he had passed away. And it was after his passing that Razis took his skills and experience back to his hometown of Al Ray, and when he was given charge of their hospital. Now, reports from the time indicate that he was extremely free with his time. He was regularly inculcating many students with the breadth of knowledge that he had acquired. He established several circles of students, sort of concentric rings, through which medical issues would pass until the correct answer was obtained. Now, if you ever watched the show like House MD, you might recognize that pattern of teaching. Basically, he wanted the medical students to collaborate with each other to try to find whatever the answer was, instilling a sense of freedom, a sense of trust that he trusted them to utilize the knowledge that they went to school for, and that they could trust each other, that if they didn't know the answer, that they could trust that if they just brainstormed with the other people, that they'd be able to do well. Now, if the students were unable to come to the correct diagnosis, he he would congratulate them. It seems like he was one of their biggest. Nope, that's not at all. That is, um, if the students were able to come to the correct diagnosis, he would congratulate them. It seems like he was one of their biggest cheerleaders, but he also gave them the correct answer if they had exhausted all of their knowledge together. Now, he did die at the age of 60, and he was able to die in his hometown, but his legacy lives on. His name and works eventually traveled far beyond its origin in the cradle of civilization, over the years making its way into Europe and influencing how things were done there. The way people with mental health diagnoses have been treated has fluctuated over the years. We will always have room for improvement. However, we must remember that at some points, things were so bad that people were just essentially jailed and chained to the walls and just left for dead. Horrific conditions, horrific ideals of treatment, and general treatment of those patients have been present all along. And like I said, there's definitely always going to be room for improvement. But who knows where we'd be if Razi's hadn't found his calling. Because of his contributions to the mission of training doctors to be better with patients in general, but specifically in regards to people with mental illness, contributions that are still visible to this day. He was the pioneer of mental institutions. He was a pioneer of psychotherapy. He was the first known advocate for those with mental illness. And therefore, he is our first member of the Heroes of Mental Health History. Thanks for watching. Like, subscribe, check us out on Instagram, and share with a friend. I'm planning on doing more videos like this in the future. It's sometimes hard to just get me to sit down in this chair, but hey, listen, a little bit of good news and all the bad, right? At least we have a way to care for the people that we have, and things are bad out there, folks, but at least we have each other, right? Stay strong.